If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. All right, man. Another week in President Trump's America. And
full steam ahead.
Full steam ahead. Holy cow. A lot has happened this week. And I feel like when I hear myself say that at the beginning of a show, it's almost like I'm trying to hype up the show, but it's not that. I'm weary from how much we have to keep up with.
I've been trying to cut the number of stories for like the last 6 shows.
Right.
And it's difficult to cut back because there's so much stuff going on.
Right. Was it last week that the AI action plan came out? Was that last week?
Yeah, that was last week.
Yeah. So this week we're going to talk about a big rollout on health and a big rollout in crypto that happened this week. I mean, these are like they're big rollouts.
Yeah. Yeah. There's whether you agree with them or not, the Trump administration is running like full steam ahead, doing a lot very quickly, a lot of change very quickly.
I feel like this confirms something that we talked a lot about in the first 30 days when all the executive orders were rolling out, which is the fact that, one of the distinguishing features of Trump 2 versus Trump 1 is he really does have the A-team around him this time around. He's got people like I thumbed through the the crypto plan and it's like, dude, it's exactly what it's supposed to be.
Yeah.
It's exactly what it's supposed to be. We'll talk more about it when we get to the stories, but he's not writing all these things.
No.
You know what I mean?
I think that Trump, the 4 years off, I think he learned a lot about like how to build the cabinet, how to sort of prepare what you can do in the first 2 years versus when maybe you lose the midterm like you did previously. So he, in the transition time, I think he mapped out, okay, in 2 years, I'm going to do all these things. And he brought in a bunch of people that can act, without his direction at every step. And then they come in and say like, what about this? And
it's and
the healthcare tech side, we will talk about that too. It's also good. I mean, now whether they can execute on it, we'll have to talk about when we get there, but it's put together pretty well.
Well, the difference is like, he's not afraid to go after people, right? So it's like, if he brings you to the table and he gets you to agree to something, there's a different level of, your ass is on the line for signing that kind of agreement than there would have been under, previous administrations.
At least during the next 3.5 years.
Yeah. I mean, previously that kind of thing would just be like a PR stunt to sort of satisfy the media and like get everybody. But as we know, the healthcare industry would go like, they'd roll their eyes and be like, okay, whatever.
Right.
Like, great. Now we can go back to doing everything that we, and it's like, no, it's not like that anymore. You know, now if you sign up for something like that, you're almost certainly going to be held accountable to it. You know what I mean? Like he's not wasting his time with press things that he doesn't intend to follow up on.
Yeah. And he's using the power of the pulpit, speaking, convening, pressuring these letters he sends out they seem to be, pretty effective without having to pass a law. If you just get these companies to agree, then it's faster.
Yeah.
Obviously.
Yeah. So, okay. That's enough preamble. Let's go ahead and dig in. Starting with the economy, as we always do. GDP numbers came out, and if you're looking at the chart with us here, it looks crazy when you're comparing Q1 to Q2 of 2025. But of course, the key story here is tariffs, right?
Yeah.
He came out of the gate swinging with the tariffs. Everyone got scared. They loaded up on goods. That actually had a very negative impact on the way that GDP is calculated. And so we had this like negative, was it 0.5% for the first quarter?
Yeah, it was negative 0.5 for the first
negative
quarter.
0.5% for the first quarter. And then, as things have sort of swung back the other direction, we didn't buy as much stuff because we had a surplus of it.
Right.
In the second quarter, we were up 3%. So I think your read of this is that we actually should be blending the two. Is that right?
Yeah, I think that's right. People, Trump was talking about tariffs all through the campaign. Everyone knew he was going to come out with tariffs. So I think in Q1, a lot of people kind of front loaded their purchases, and then in Q2 they didn't buy anything.
Right.
I think most economists are blending both quarters together, and it ends up at like a 1.9. So it's still okay growth, but it's not really this tale of a Q1, Q2 being so different. I think it's just a trade moving trade forward, basically.
Yeah, I mean, given the amount of disruption that Trump has introduced, a blended 2% growth over the course of the first half is pretty good.
Yeah.
Actually, it's actually quite good.
Yeah. Oh, yeah. I think that's right. And we haven't seen any really significant inflation from the tariffs.
No.
And we'll probably talk about it.
Well, they never settled anywhere. It was a lot of threats, and there was this 90-day hold. So, you know what I mean?
Yeah.
Like, if anything, it slowed business transactions. It slowed people from doing things.
Yeah.
It intermittently rose prices. But even like, I've got a portfolio company that only rose prices for 1 month.
Yeah.
And then kind of retracted right back once everything sort of settled in.
Yeah.
Right.
Yeah, we'll see. I mean, I think both Japan and Europe, which we have a lot of trade with, are at 15% tariffs now.
Right.
So we're going to be collecting a decent amount of funds into the Treasury. And two, it could increase prices over time, but so far it hasn't.
Yeah. We'll see what the actual implementation of this looks like. I mean, the default is almost certainly going to be U.S. businesses and U.S. customers are paying in that 15%.
Yeah, maybe. It depends on if companies can absorb it because their costs are being reduced somewhere else. They're using technology in some way, and they can reduce expenses in another place. I don't think we know.
Over time, yes.
Over
time,
5 years.
Over time, there's no question.
Right.
Technology is going to deflate away those type of expenses.
Yeah.
Yes. All right. Next story. Wall Street Journal. Trump and the EU reached tariff deal, avoiding a trade war. So this was expected after the successful negotiation with Japan that the EU would also land at 15%, and now we can put this one behind us as well. Yeah,
and the EU I was worried about the EU because there's the two different levels. There's each country in the European Union that have very different trade interests. And then there's the EU as a whole, but they got it done.
Yeah. And then Jerome Powell held back on a cut again, but this time there's sort of a display of unity is missing amongst the FOMC with two of the members saying that we actually should have done a cut this time.
Yeah, that's right. And I can't remember the stats. It's in this story. It's been several years since Chairman Powell has not had a unanimous consent.
Right.
Maybe like 5 years or 7 years or something. A long time. So it doesn't happen. It's not like a matter of course where they always are fighting over things. It typically is a show of like a consolidated, this is what we're doing, and it's fraying right now.
Yeah, and I mean, if two people dissented publicly, there was probably even more questions around whether or not this was the right thing to do, and you probably had people who just were sticking with the tradition, backing, Powell because they felt that was the right thing to do. But I said to you as soon as I read this story that this cut to me feels, or this lack of a cut, I should say, feels out of touch. It feels like, and I'm not talking about the numbers or the data. I'm talking about the sentiment, right? Like there needed to be a little bit of pressure relieved in the overall situation at this point, right?
Yeah.
You know what I mean? And this just felt like you're digging in your heels.
Right.
And you're not, it just,
I mean,
a 25 basis point cut would have helped or hurt nothing.
Right.
But symbolically, it would have like taking the pressure off of the situation.
Yeah, and it reminds me of last July. So last July, the exact same thing happened. Not the dissenters, but there was a lot of pressure from the Biden administration and from me and from everyone that we needed a cut.
Even Elizabeth Warren.
Yeah, everyone was. And then there were it was the Japanese carry trade blow up in early August.
Yeah.
And so then we had, a kind of a problem, and the Fed had to do 50 points in September.
Yeah.
And so it feels like, Groundhog Day. Like he should have done a quarter point cut to relieve the pressure. It feels much more like he took it personally, the fights with Trump, and just is not digging his heels just to do it, which is not good in any sense. But we'll see what happens in September. I think he's going to need to cut then.
Yeah. Yeah. I think he got a signal with two of the other officials not joining him on this one.
Right.
I think he got a signal that like his block is fraying, right?
Yeah.
Okay, moving into VC deals. Stat news. Ambience has a new mega round. AI Scribe has announced nearly $1 billion in funding. They are a competitor to Abridge. And this round was $243 million in new funding. So Oak HCFT, Andreessen Horowitz, OpenAI, Kleiner Perkins, Optum Ventures. So really, really strong group here. AI Scribe's basically dominating the healthcare AI bucket.
Yeah. Yeah. I mean, $975 million, almost $1 billion in capital raised this year on maybe 8 different scribes. They're all raising a ton of money. I don't know. I mean, I guess it's a good place to be, but there's a lot of competition and they all kind of do the same thing. So.
Yeah, it feels to me like you're just kind of storming the market. None of them are building frontier models, correct?
No, they're all just like using. That's why OpenAI invested in this one. They're all using one of the models.
Yeah.
Which I think is not that sustainable.
I don't quite understand the size of these rounds relative to that. It's like, do these large rounds represent a greater ability to sort of sell through or cut sales cycles in healthcare from your perspective? I mean, now, granted, we've seen reports over the course of the last 2 or 3 weeks where CIOs are saying AI is the most important thing for them to focus on and get in. And so I do believe there's a universal focus on ambient listening and, taking some of the pressure off of already very stressed, clinical workforce through ambient AI technology. So I do think it's kind of like a make hay moment. I get that part of it. And maybe because of that, you're saying, hey, there's a lot of capital flowing in. You and I did, we were reading, PitchBook and Carta's results for the quarter in the first half of the year. We don't have the story here, but AI represented about 35% of deal count.
Yeah.
And like 66% of the deal value, largely because OpenAI's $40 billion round was like 57% of all the VC fund.
But still, a third of all the deals.
A third of all the deals.
From a count point of view were AI.
That's right. So, I get that part of it, right? Also, you got these mega funds. They have the capital. They have to deploy it. They need to make plays. They got to write big checks. So there's some of that too. But there is a question like, do you need these kind of checks to do this?
I have a take on it. I don't have the facts on it, but my take is that I believe they're subsidizing the price. I mean, I think they're bringing ambient scribing to health systems and charging per token less than it costs them per token to do the scribing. I mean, we definitely saw this in the Uber, Lyft, gig economy time. This is maybe 8-10 years ago now, but where the gig economy companies raised a bunch of venture capital and they subsidized the product, gross margin negative, in order to change people's behavior. Yeah, with the idea that there's going to be, the best known brand will get 60% of market share. The next one will get 30.
Yeah, and then
Uber has successfully navigated this. Then they would raise prices after they
After
already
that.
established 60%
Which has
market
happened.
share, which has happened. I think there's an aspect of definitely in the frontier models. So we'll have it later, but OpenAI is raising $40 billion. Anthropic is raising, $10 billion. They're all sort of talking about their revenue and their burn, and their revenue is tripling this year, like so 3x last year, but their cash burn is also tripling.
Right.
And that says to me that they're running that playbook. They're just trying to get people to use their system, and then they have more data, they have more usage, they have more brand, and they'll figure out how to raise prices later. And I think the scribe is the place in healthcare where everyone needs a. I mean, as you said, all the health systems need a scribe, so they're trying to get positioned. Anyway, that's why you need so much money if you're subsidizing.
I think you're making a good point. I am, and what I'm about to say doesn't negate anything you said. I'm just thinking about the overall headwinds of the market they're selling into, and how that's different from an Uber or a Lyft. And so, which I think had tailwinds, but because it's a two-sided marketplace, this is not that, right? You know what I mean?
Yeah, it's not two-sided. It's also not direct to consumer.
No.
So like a big health system,
it's a captive market, and it's
will
enterprise.
switch if they want to switch.
Well, not just that. It's a limited and shrinking pie. Everyone who studies hospitals knows we are going to have less hospitals, not more.
Yes.
So that's the only part that I'm just a little bit.
Yeah, I don't think Ambience Scribe is a standalone product 5 years from now. It's not. I mean, it's not even a standalone product. They're going to have to broaden to a more robust set of offerings.
Arbital Health lands $31 million to build out infrastructure layer for value-based risk contracting. This is fierce healthcare. I think this is smart.
Yeah, that's right. I mean, this is one of the more interesting business models that we're covering that I hadn't really thought of before. But value-based contracting is super complicated. You have different sides of the contract fighting over every little piece. And so having an independent third party navigating that in a agnostic way that's fair seems like a pretty good idea.
Yeah. And also, I mean, with some of the threats around upcoding, you might even need this even in the payvider scenarios. You might need it even more in the payvider situations, right?
Yeah, I hadn't thought about that. That's true too.
Yeah. So I think this is a pretty smart business. Charta Health picks up $22 million to revamp manual chart review with AI. I mean, smart, but like not unique.
Yeah, that's right. This is not this is a Me Too one, but if they do it well, it could be good.
Yeah. I mean, medical billing and coding, yes, that there's a lot of work to be done there. And
all the AI scribes are going to come into the space.
Yeah. And there's going to be a lot of buying activity going on there. So, good luck to Charta Health. Okay, moving on to policy. This was a big story that rolled out this morning. I'm trying to keep track of everything.
It was sort of last night.
Last night?
Yeah.
Okay. Yeah. Okay. July 30th. Okay. The White House and CMS to launch health tech ecosystem initiative to expand use of digital health with a focus on consumers. And so there's no actual official policy here, but there was a convening where they brought together everybody from, your favorite payer to your favorite LLM and everything in between. And
Epic, Oracle.
Yeah, sure.
Mayo Clinic.
They had them all at the table.
Amazon.
Had them all at the table.
Yeah, they're all there.
Yeah, and got them to basically say patient data needs to be with patients, and we're not going to block the information, and we're going to actually leverage these existing interoperable standards that have been around forever, right? I mean, Vic, as you remember, we had an industry initiative here in Nashville, the Center for Medical Interoperability. Yeah. And then everyone realized how hard it was to actually get anyone to behave, and so that didn't work. And it wasn't for lack of trying; it was you couldn't get anyone to actually do anything. And I think the difference is like Trump can motivate people to do things because they know he's like there are consequences with him. And the truth is, why didn't anyone do this stuff before? There were no consequences. We had Blue Button. We've had all sorts of standard.
Yeah, we've had Fire.
None of that part is new. What
it's
is
not
new is
technically,
consequences.
it's not technically hard.
No, consequences
Right.
are what's new.
Yes, that's right. And I mean, I have to give Trump credit. He uses the power of the Oval Office in a way that is pretty effective and is different and I think more wide ranging than other presidents. And so he did I listened to the 45-minute little press conference. Trump comes on and does his 5 minutes of introduction,
As he always does.
But then they had Kennedy and Dr. Oz, and then the real star of the show was a woman named Amy Gleason, who is a member of the DOJ department, and she's going to be heading this up. And she really did a good job sort of explaining why the executive branch should be doing this and how it's going to benefit patients. She has a daughter with a significant rare disease. She talked about that. And then Dr. Oz got on and sort of gave the doctor's point of view of wanting to give great care, but not having the resources, not having it easy. And so they did a good job sort of painting the picture of what this could be as far as benefits to the voters, to the citizens.
Right.
And then turn to they had 60, private industry participants there for the 60th birthday of Medicare. I don't know. I'm hopeful. And then they have good taglines like "Kill the clipboard," "Axe the facts," or things that I can remember.
They're so good at that.
Right.
Yeah. Look, again, if I'm looking at, and of course I've got my own personal gripe with the whole like let's leave climate change out of LLMs. It's like meanwhile,
right.
Earthquakes, tsunamis,
right.
flash floods. You know what I mean? Like I'm kind of like, okay, fine, whatever. But when you look at the AI action plan, this health tech ecosystem rollout, and then this crypto thing that have all rolled out in the last 2 weeks, right? It's like not only promises made, promises kept, but also it's just hard for me as an innovator to find fault with how forward thinking this administration is. It's just like,
yeah. I mean, I have complained. We've all complained about we spend too much money. We have bad outcomes. We don't. No one likes the clipboard.
But for God's sakes, it's 2025.
Right. So they are taking action and trying to fix it. Now they're doing things that I wouldn't do. I don't like every aspect of it, but they're definitely working on things.
Look. There's no question that there will be issues and there will be all sorts of collateral damage.
Yeah.
Largely from the speed with which they roll these things out, right? Like, there's no question there will be collateral damage. I guess I'm simply saying that when you compare this to the predecessors, it really is an indictment of previous administrations. Failure to include Trump 1. Right?
Yeah.
Failure to meet our country where we are in terms of our capabilities to advance some of these really critical things, right? Like, as long as we've been in healthcare, people have been complaining about the EMR. As long as we've been in healthcare, people are complaining about the clipboard and the fact that it's a bad joke. Talking about faxes, it's a bad joke, but yet we still do it because of X, Y, Z.
Right.
And we've been talking about FHIR forever. And I'm a technologist, man. I came from a world of APIs and all this. I just stopped even trying to think about it. I was like, forget it. Maybe I'm just too stupid to understand why this industry, why the financial services industry can integrate at every single point. Right.
Yeah.
Where the airplane industry can integrate at every single point. I can use this app Flighty to know every single thing about my plane before it arrives. I can know everything about it. But somehow in healthcare, even with Apple Health on my phone, I still can't actually have my own freaking EMR record. Right?
Yeah. And it's because the industry was protected.
Yes, that's the bottom line. It's called regulatory capture.
Yes,
and it's that internal thinking. This healthcare is different. There is some ivory tower elitism to it, And it's all part of this negative sentiment that's been building up around this industry.
Yes. Yeah. I mean, we were both alive, but not paying attention. At least I wasn't paying attention in the 80s to politics, but there hasn't been a president while I was an adult and voting and paying attention that has moved to this speed. Maybe the reason I went to the 80s, maybe Reagan. People say Reagan did a bunch of cutting bureaucracy, cutting regulations. I don't know.
I don't know.
Yeah, neither one of us were paying attention then.
Yeah.
But since Clinton, when I started paying attention, no one has moved to this speed.
Yeah, it's insane. It's really a lot. Trump administration weighs patent system overhaul to raise revenue. Okay, now we move from something that was like exciting to something that's like WTF.
Right.
Really.
Exactly. And Howard Lutnick is my least favorite of the cabinet.
Same.
I think
I won't even tell you who my least favorite is.
Okay.
Because
I don't know if I could name the whole cabinet.
Because then I would be getting very political.
Yeah, okay.
I'm not going to do that. But I will say, certainly in the realm of like of economics and finance.
Yeah.
I mean, especially when you're comparing him to Besson, it's like,
yeah, right. Or Kennedy even. I mean, who was just.
But I know we're spinning on Lutnick for a second. But I will say I heard a podcast where they were comparing Lutnick and Besson, and they made a very, very good point, which is Besson was not going to help Trump get elected. Lutnick was, right? So it's kind of like Lutnick was the guy you needed to get Trump into office.
Yeah.
Besson is the guy you need to keep Trump in office, right?
Yeah.
You know what I mean? It's like it's just the difference between elections and governing.
Yeah.
They're two different things.
Yeah, and I think too, in his defense, I think Trump has tasked him with finding more money.
Yeah, fair.
Fair. Anyway, so Lutnick came up with this idea to overhaul the patent office, which I think needs to be overhauled, but not in the way that he's doing it. So he is talking about something, I'm going to relate it, but I don't know how it can be functional, which is when you apply for a patent, there is a fixed cost, $5K, $3 to $5K, but then they will assess how valuable this patent will be, I guess, some way, and then charge you a percentage of that. And that sounds like it could generate a lot of revenue until you start asking, well, how are we going to know what this future patent that you're now about to issue, you haven't even issued yet, is going to be worth? I mean, I'm a venture capitalist. I don't know how to do that.
I was about to ask you, Vic, how do you know how to value things? Because I know we do at Foundry. We tell everybody your baby is beautiful enough to be valued at this.
Right, exactly.
All of you.
You're all this. I think of it as a binary outcome. You either produce a product that people like and buy, and then you change your net worth materially, or you don't.
And look, I consider patents to effectively be pre-seed. Like unless you're taking something that's already been working and you're saying, wow, look at the viability of this, and I hadn't really thought about it, but it is unique and patentable. Let's go ahead and patent it after the fact.
Well, I think as a percentage, I think more than half of the patents issued are issued to Google, Amazon, Microsoft.
Okay, forget them, because that's not who this is going to impair or impact. Let's talk about you and I. We come up with an idea. I have a utility patent.
Yeah.
So we come up with an idea, like we're going to get a valuation on that, and we're going to have to pay against that valuation 1% to 5%.
Not even that. The patent office is going to value it.
I understand that, but I'm making the point,
and I think systematically they're going to value it high because they get more money.
Yeah, and hold on. Here's another thing. You're trying to tell me the patent office has experts in every single field of the world to be able to effectively value these things into the future?
This is a good example of a terrible idea that the Trump administration is trying to push through.
And also, it's the Commerce Department. Like, he probably doesn't even care. He's like, whatever. You can go over there and play. And it's like, whatever.
Yeah, so I don't think it's functional. But I wanted to cover it because in healthcare broadly and in startups, patent and IP protection is critical.
Yeah.
And so we need to follow this. But I don't think it's I don't think it can go through like this.
Yeah, I mean, we already have a decrease in funding going to pharma, biotech, and devices.
Yeah.
The only category in healthcare VC that's growing is software, technology, and I think that's largely like it's a derivative of the AI boom, right? We just went through $1 billion, not in AI, in AI scribes.
Right.
Like we didn't talk about revenue cycle, we didn't talk about coding, we didn't, you know what I mean?
Right.
Just the scribe business got $1 billion this year. So, yeah, I mean, I think.
I mean, there are other ways.
This is not helping an already flailing.
Right.
You know, you've cut grants because like the real value of patents is hard tech, deep tech, right?
Yeah.
Whether it's in a lab or in a wet lab or it's dealing with rare earth or whatever, it's serious engineering, right? Serious science, and there's already enough issues against that stuff. Yes, you've made it more tax friendly to do R&D work. That's fine, but the core dollars, the actual cash, tax is an after, cash thing. I'm talking about the cash on the way in.
The NIH grants,
yeah,
and
the
research
cash on the
grants,
way in to do this stuff. Yeah. That's decreasing across the board. Both private and public sources are decreasing. Yeah. And now you're going to increase expenses at some variable that I can't even predict. It's going to be up to whatever the office says.
Right. So there are ways to get more money into the patent office, but this isn't it. Like you could charge based on the revenue of the applicant, right? Like, so if Google wants to apply, they have to pay slightly more than a startup that doesn't have any revenue. Or you could take some royalty percentage on every patent issued, but it needs to be a standard that is independent and no one has to use judgment for. It's just like, this is the way that because I think that's the only way it's feasible, but we'll see what happens. I don't think anything will happen really.
Medicare Part D drug plan premiums set to rise. This was something that went past me. There was so much focus from HR 1, One Big Beautiful Bill on Medicaid and the ACA. Those were the two big areas of focus from that bill. And so, I missed that they also cut the subsidies to the payers for Medicare Part D. So, it's like when you really take, and I'm sure Wall Street didn't miss this because when you look across the sector and how they, it doesn't, like we're going to talk about this later, but the number of headwinds being thrown right now.
Healthcare is a lot.
It's specifically the payers.
Yeah.
Specifically the payers. It's a lot. But all these things adding up to premiums going up is just going to add to leaving markets and people not buying the product. People just not going to buy the product.
The healthy people are not going to buy the product.
Yeah.
And so, I mean, it's insurance 101. You're going to get bad signaling with all the people that actually are very expensive.
Yes. Worse risk pools.
Yes. Right. So,
but by the way, unfortunately, I believe there is a socioeconomic tie between their ability to pay the premiums and the quality of their health overall. When you look at the risk, it has to be at least correlated. I'm not saying it's causational, but it has to be at least correlated. So it's just headwind. Yes. You know what I mean? It's like it's bad.
It's headwinds for the industry, and the lower part of the K, it just cannot catch a break. Everything is headwinds for that population of people that need more help than the upper part of the K.
Yeah,
but they're not going to get help.
No. This era that we're in right now, I was having dinner with CEO of a high-performing fintech company on Tuesday. And, we're talking about a variety of different things, and he was telling me that he bought like a bunch of gold, just stuck it in a safe, and he was like, I feel so rational. I was like, no. That is your brain processing your nervous system, picking up on the fact that this era, the message is you're on your own. Mm-hmm. And that's why you went and you bought gold bricks, because you're on your own.
Yeah.
You're on your own, and God bless you for being able to buy those gold bricks, right? But like think about the people who have been dependent on this system for like survival.
Yeah, that's right. I mean,
they were also getting the "you're on your own" message, right?
That's right. And the other aspect of that is that no longer will smarts, effort, hard work, education make a difference? Unfortunately, I don't believe it's possible to pull yourself up through intelligence, hard work, studying, effort.
Intelligence was the last
one that was
one,
okay,
and
it's
it,
disappearing.
it's gone.
Yeah.
It's gone now, right?
So anyway, Wall Street Journal is covering this because of the next story, which is Trump is trying to soften the effect on this by really aggressively pushing the pharmaceutical companies to provide better pricing to Americans.
And Larry Levitt reposted on X this letter from Donald Trump to the CEO of Pfizer, and basically telling him, you need to give us most favored nation pricing. I mean, this feels like the next wave that we're going to be dealing with over the next 18 months. You can't do it immediately, right? Because like too many Americans are too dependent on their pharmaceutical drugs, and like we need, you just can't create shocks in that part of the world. Mm-hmm. We have an FDA story we'll talk about later where it's like, don't screw with people's drugs. You know what I mean? Because that's their sense of security in the world for good reason, but he's starting. He's starting the process of forcing these pharmaceutical companies to price in accordance with the way that they price globally.
Yeah, and the this is just the Trump strategy, I think, which is he makes a bunch of demands, reduce your prices so that Americans pay the same or less, most favored nation status compared to other countries, and make binding commitments by September 29th. There's like a hanging, or else I'll do something that you won't like, but he doesn't actually commit to anything. But like
he doesn't have to,
right? He doesn't have to. Biden had the well-intentioned idea of bringing in the pharmaceutical companies. He picked very expensive, I think 10 or 15 or something, and pushed on that. It was just very process-driven, and how leaders have done government policy forever. And Trump doesn't worry about that. He just like runs over, writes the CEO a letter demanding to be treated the same as other countries, and puts a very short timeline on it. And I mean, it might work. Look, if it doesn't work, it's going to mean something will happen.
It matches the America First meme.
Yes.
Right? It matches the America First meme. And that is one thing. He manages to be, whether stylistically or even tactically you disagree with what he's doing, when you put it all in a, you have to apply intelligence and logic to it to identify areas where that narrative falls apart. But on the surface, it all matches the meme of America First.
If you are coming to a Trump rally or whatever, listening to talk radio, the meme hangs perfectly together.
Yes.
Yeah, Trump's fighting for us or whatever. The details don't matter. They don't go through the details.
Right. Exactly. That's the main point. Like if you sift through it and go through the details and you run game theory, or you run the health economics out, or you run all these things over time, you see. But when you're doing all these things very, very quickly, and all we can read is headlines anyway. Like we're the TikTok generation. Like, we have no attention span.
Yeah.
It all matches the meme.
Yeah.
It all matches the meme. That's right. This is from Fierce Pharma. Vinay Prasad departs the FDA amid conservative criticism, controversy over Sarepta gene therapy. So this is the drug that has been a little bit controversial for Duchenne muscular dystrophy, and has resulted in some deaths. And apparently, Dr. Prasad tried to halt the drug. And, the Trump administration is very, very big into right to try. Duchenne is a very nasty disease. And so, there's a different sense of sort of what's allowable when it comes to the risk reward profile for these types of drugs in these really, really ugly diseases. This is not diabetes, right? And Dr. Prasad did not make it. He did not make it to the other side of that decision. The drug is back on the street and he is out.
Yeah, that's right. And at some level, 3 people died. And so for the FDA to to say we're going to stop usage and study this for, pick the time limit, 30 days or some amount of time.
Yes.
That seems like sort of the job at the FDA.
Yep.
But yes, the flaw was not allowing the patient to raise their hand and say, I understand and I want to try it anyway. I think that's the lesson. But yeah, when public sentiment goes against someone, I think you're out quickly.
Yeah. Yeah. And they're just not going to even play, right? I mean, and the other thing is like, he's like embedded in the FDA. He's not a name. You know what I mean? You got to be in the space to know who he is. And look, the way that RFK is cleaning house with folks in the HHS anywhere, like it just doesn't matter.
They'll reload someone else in.
Yeah, it doesn't matter. All right, moving to the 80 million. This is the Manat publication on all things Medicaid. They do a deep dive into the Rural Health Transformation Fund. This is the $50 billion. I think Murkowski probably gets the credit for putting into HR1. And they just sort of analyze it and make the point that like it's no it does not make up for the $70 billion loss that the rural hospitals are going to face, right? It's 20 billion short of that. It's temporary anyway. It's a Band-Aid on something that's much more persistent. And finally, like you don't even know if the $50 billion is actually going to the hospitals, right? I mean, like you and I know a couple of very, very large influential funds that like to develop all sorts of VBC models for the rural population specifically. And if I had to guess, I would imagine they are looking at that $50 billion like, let's go, right? Like that looks like, great transitional money for us to prove that we can outperform those hospitals in those markets.
Yeah. I mean, I think it's both ends. Like, I think it's positive. Right? Like $50 billion does not make up for the $70 billion in cuts, but it is better than not having that. We got added in the last 12 hours of the bill.
I find your characterization of it as positive to be generous, given the other things that the bill caused, right? Like, so to me, that's a little bit like, I punch you in the face, but then I give you, some rubbing alcohol and a Band-Aid. And I'm like, it was positive. Look what I just did. I gave you, you know what I mean? Like, so I think we just, I just don't want to get sucked into that kind of narrative. I feel like that's kind of the point of this piece.
I think that's right. And the talking points, part of the reason I'm saying that is that I just listened to this healthcare tech, 45-minute speech, and Kennedy talked directly about this and spun it as a positive for rural patients.
Well, okay.
Because he had the microphone and he can spin it as a positive.
Yeah, and it exists. It's a talking point for them now.
Exactly.
It's a talking point for them now.
That's right. It's going to be, it's the Band-Aid and solve after I punch you in the face. I think that's a good way to think about it.
Yeah. So anyway, I'm glad you selected it. I mean, it's important to sort of know the basic math, which is that this is 20 billion short and also one time, not as persistent as the projected losses. New York Times appeals court hears legal challenge to Trump tariffs as trade war widens. So you got to educate me on this one.
So Trump is using, I'm not going to get it right, a certain statute related to national security.
Yeah, it's around national emergencies, right?
It has an acronym, but yeah, you have to make the case that there's a national security risk to enforce this tariff. That's how he's enforcing the tariffs without Congress approving.
Right.
The president can do tariffs if Congress agrees, but he didn't want to go through that process.
No, he wanted to do it unilaterally. Right. So he just asserted that we were in an emergency.
IEPA, what it's called, at IEPA.
Yeah. International Emergency Economic Powers Act.
Yeah.
Okay.
And so various people that were harmed by the tariffs, of which there are a lot, companies or whoever, have sued saying that these tariffs are not legal and therefore need to be reversed. And you have to return the money, importantly.
Yep.
And so Trump won the first trial, which was at the district level maybe, and now they're at the next level. And it's going to go to the Supreme Court, I think. The legal people I've been listening to think it's probably 70% likely that he loses.
Yeah, he loses just on the letter of the law.
Yeah,
right?
just on the letter of the law. And it's going to go to the Supreme Court. They'll rush it through. So there's a, whatever the next level is, the appellate court maybe. There are 11 judges on a panel at this appellate court hearing the arguments today. They'll decide one way or the other. Whichever they decide is going to then, the other side will appeal and it'll go to the Supreme Court. But by the end of the year, there's a 70% chance that the
all
tariffs,
this stuff gets unwound.
Yes.
Yeah.
And so I think part of the reason Trump is driving to get like trade deals is that he understands that.
Yeah.
And if he can sign a deal with Europe, then it's fine. Then now he has a trade deal.
Yeah.
So I don't know. It's going to be a mess if they have to unwind the tariffs and send all the money back. But it looks like there's 70% chance of that.
All right, moving into the payer sector. It's Wall Street Journal. Humana raises 2025 outlook as revenue tops estimates. That's a good headline for Humana. They previously expected it to be 126 billion. Now it's going to be 128 billion. So looks like they took their medicine before and kind of reset the guidance to a pretty low place, and now they're able to beat that. That's good. And yet, they did not get rewarded with any type of stock bump or even neutral. They were down on the day from the news.
Yeah, that's right. I mean, I think the market just does not like payers. I mean,
not right now.
They couldn't have done anything different. They raised guidance. They had everything that you would expect to mean the stock would do well.
Right.
And it didn't matter. It was still down 5%, 4.5%.
Yeah. So that's a pretty consistent story. Here's a story from Wall Street Journal about UnitedHealth continues to struggle as rising medical costs, shortfalls affect the business. It seems that Stephen Hemsley, who was the chairman, has stepped in as the CEO, is as part of his work to turn this thing around, is just going ahead and saying, we're just going to take all the medicine right now, right? So we're cooperating on the DOJ investigation. There's some serious things we need to work to clean up in the business. And he's just like, let's take the hit right now. We're already down 50%, from the high this year. I think this is smart. Like, do as much as you can to try to get the market to give you a new floor.
Everything. Yeah, right.
Yeah, get a new floor that you can work from, because the Humana experience of going out with a beat, $2 billion better than guidance, and then getting knocked down 5%. It's like, if you're already in a window where the sector is going to get knocked down, this is the time. Go ahead and take all the bad right now, establish a new floor. It probably runs at least for the rest of this year. And do the hard work to turn this thing around so that next year, hopefully, you can tell a different story, right? So
I mean, they've taken their earnings down from $30 a share estimate in January to 16. So it's half as far as profitable. So I think you're right. I hope you're right that he's throwing the kitchen sink and everything else in to sort of overcorrect, and then they can start performing.
Yeah, I mean, he is he certainly comes across as like a trusted, person with the hands on the wheel, just being just around for a very,
in a lot of
very
ways,
long
he
time.
built the company.
Yeah, being around for a very, very long time, and so I think I've said this a couple of times. I think they have the right guy in the seat to sort of deal with all of these different challenges, and the only way out is through. When you're kind of in a place where they are, the only way out is through. So, all right. What else we got? CVS Health hikes 2025 profit outlook as Aetna insurance business improves. So, I mean, look, some good results here from many of the large healthcare companies. We got some good results on the provider side as well. Yeah,
that's right. I mean, there definitely are. This week, there's been several good earnings reports from payers, and we're going to talk about HCA too. But on the payer side, it didn't really matter, right? CVS was down. We just go to the next one. Cigna also had a great report this morning. Their
But they
Evernorth
were down as well.
Yeah, they're down too. So
Yeah, and
they
they're
beat
commercial.
Outlook. The Evernorth, they're commercial, which
they're
is
commercial.
pretty
They
protected.
got rid of the Medicare Advantage
Yeah.
business, sold it to what was it, HSBC or HC? I forget. HCSC is that the name of that company?
HS. I can't now that you.
HSBC is the bank.
Yeah. It's a whatever. It's one of the blues plans.
Yeah.
So they have a very predictable business. I mean, the commercial book of business is going to be fine, but it didn't matter. They still were down.
Right. HCSC, by the way, is who they sold that to. Okay. A federal judge blocks an Arkansas law barring pharmacy benefit managers from owning pharmacies in state. This is the AP. So in Arkansas, they were dealing with what they believed to be the PBMs crushing the small independent pharmacies, and so
and a small pharmacy called Walmart.
Yeah, and Walmart, and of course Arkansas, right?
That's why.
Yeah, Arkansas, and so Sarah Huckabee Sanders signed this restriction into law. CVS and Express Scripts sued the state, and that has now been reversed.
Yeah, that's right. And so, for right now, the law can't go into effect. Maybe there's some way to appeal. I don't know, but CVS owns PBM, and they are allowed to stay open.
Yeah. So, I mean, it certainly feels like a tough thing to get across the line. You're going to just block CVS from operating in the state of Arkansas, where their competitor Walmart also happens to be headquartered. You know what I mean? Like it just
Walmart doesn't own a PBM. Right.
Yeah. So that it just.
I mean, it's like all these political things. They show off the independent pharmacies, which are struggling due to PBMs. So that's right. But I don't know that. I mean, if you get rid of all the CVSs, I think it would be a transition period at least.
Yeah. Okay, moving on to the providers. HCA raises 2025 guidance despite softening volumes, and their stock was up.
Yeah, they came out on Friday, right after our show, but they performed well. They're good executors there. They have a good set of assets, and their stock has done well. Yes.
Yeah. UHS posted softer than expected volumes for the second consecutive quarter, but they were also up.
Yeah. So they didn't deliver a great earnings, and I don't think their set of assets is as good as HCA's, but they sort of got a lift from maybe the overall sentiment.
Yeah. And then Teladoc Q2 revenue declines 2%, slightly beating Wall Street estimates. And so they actually have an integrated care business that performed well and was up 4% compared to last year. But the thing I sort of put an eye on was that BetterHelp, which was, sort of a big play for them, was down 9% year over year. So that's just, that's not a good trend for the virtual behavioral care business for them. And BetterHelp is kind of the big brand that you see out here in terms of all the marketing and brand building that they're doing. So for them spending all that money on brand building and be 9% down year over year, that's tough.
Yeah, Teladoc's a hard platform. It's not that differentiated from a whole bunch of other places now.
Yeah. The U.S. opens antitrust investigation into NewYork-Presbyterian. So the idea here is that New-York-Pres has colluded with health insurance companies to basically set pricing in a way that is disadvantageous to their competitors and, unknowingly locks in their customers.
Yeah, that's right. And I think it is.
By the way, this is the alleged.
That's the allegation.
That's the allegation.
Right.
Yes.
And I don't know the facts, but I do know many hospitals that try to create a avenue to have something that they can offer a payer that other people don't have. Maybe it's a burn unit or a children's hospital or something, and then they use that as a negotiating tool. And that is a fine line between appropriately using your features in a way that's fair in the market and collusion. And I think for a long time, health systems people have sort of looked the other way and not worried about it. But I think that's changing now.
Mm-hmm. Mm-hmm.
But if this court case goes through and there's a change, there's a lot of other health systems that need to think about what they're doing, I think.
Moving into pharma, Novo Nordisk shares plummet as competition weighs on sales. Guidance cut sends stock 30% lower. Good night. As the company named the new CEO. So new CEO will have a good year to be able to point to the old CEO and blame him for all this stuff. But 30% drop. Goodness gracious.
Yeah,
that is brutal.
They really are in trouble with the compounding. Really HIMSS, but all the compounders are still.
How is that happening? I mean, you and I have been tracking this the whole time. It seems fairly clear this is not allowable.
Well,
you had like it has to be an emergency designation that there's a shortage of it, right? Like,
well, that's gone now.
Yeah, well, I guess that's my point. Is I don't understand why they're allowed to compound. Why is that allowable?
HIMSS has a team of lawyers, and they have decided that the next loophole to pursue is that they can compound a particular combination of things for each patient, and it's more effective that they are giving you the right dosage and the right set of things. So they're claiming that the customization is important for all of these millions of patients. And that is true if you are like allergic to eggs and they use a egg thing in the medicine. And so you can't have that medicine, but they're applying it at a much, much broader use than anyone has applied it before. And then they have this, I think, strategy. Now I'm putting my own. I know that's factual. And my strategy overlay is that they're trying to use public opinion to not be pursued around that.
Yeah, I'm just shocked they've been able to get away with this for this long. Because it feels. Look, 30% impairment, if it is truly based on competition, that's a significant impairment to this company. And, I don't know. I mean, it seems like a fundamental.
It's not fair. I don't think it's fair.
Yeah, it's as at least in terms of how we understand the rules of the game to be laid out. This does not seem correct.
That's right. HIMSS is charting a new course that I think is not fair to patent holders. Now, Novo came out with a high price compared to the cost to make the drug, right? That's not illegal.
I get all that. Those are fundamental issues that I think are exactly what Donald Trump is going after right now, and have been longstanding issues that we have with the pharma industry, like for a very, very long time.
Yes,
those are more systemic industry issues, right? That need to be addressed.
That doesn't give you the right to then just, cavalierly violate their patent.
That's kind of what I'm getting at. I just think 30% impairment seems pretty serious to be allowed for something that you can't explain to me, and you're basically saying it's like a loophole. I'm like, well, that sounds like something that should be shut down.
Yes, that's what. And
I'm talking. I'm not invested in Novo. I just think that sounds crazy.
But patent protection. I mean, the markets don't work.
Thing.
They don't work unless there is IP protection.
That's the point. Yeah, that's the point. Merck is laying off workers and narrows guidance as their earnings fall.
Yeah, Merck is not as like Novo. They just don't have great assets right now. They're sort of, their cupboard's thin as far as what they have as far as new growing products.
AstraZeneca books record quarterly revenue as U.S. and oncology boost their growth. Cost earnings per share rose from $2.17 from $1.98, the drug maker said.
Yeah, so they have the oncology portfolio that's really doing well compared to Merck that doesn't.
Mm-hmm. All right. And GSK is upbeat on guidance after specialty medicines boost their sales.
Yeah, same. So,
all right, good little pharma rundown. Okay, 2 stories about health and us. So the first one, the new implant offers hope for easing rheumatoid arthritis. That headline didn't do it for me, but the subtext here, the device stimulates the vagus nerve, signaling the body to tamp down the inflammation that contributes to the disease. Now that's a big deal. I mean, that feels like very broad applicability, way beyond.
I mean, it's every chronic disease.
Yeah, I mean, especially sort of the rise in things like lupus and I mean
all the autoimmune, everything autoimmune
feels like it's like.
I mean, I think diabetes and heart disease also are related to
heart disease for
inflammation.
Sure.
So
heart disease for sure.
The vagus nerve is. I think it's the biggest nerve in your body. It controls a ton of things. And this is it's about the size of a typical sort of a capsule, like a pill. And they insert it at the back of your neck and somehow wrap the vagus nerve around it. And then it uses electrical stimulation to change the way the nerve is sending signals, which sounds like, first of all, it sounds like science fiction. Second of all, it sounds like an incredible thing that could help a lot of people. But it's going on. Yeah, it's happening.
I mean,
right.
I think this is I'm seeing more and more Neuralink stuff like every week. I see something about Neuralink, and it just in fact I even saw something that was saying that Neuralink or some similar type of implantable might actually be the offset to us losing out to AI, right? Because there's all sorts of brain unlocking and things that they're starting to theorize that could happen there. And the implantable world, it still seems really, really strange, but it's getting less strange and more normalized like every day.
Yeah.
Okay. And then the second story is about organ donation. And that little box that we get asked to check when we get our driver's license about do we want to be an organ donor. A great nuance out of this story. This is with the New York Times. It's a guest essay, and it really peels back the layer on what actually happens when you die as it pertains to that whole organ donor checkbox, right?
Right.
Which is to say that if you're brain dead, your organs are still in pretty good shape because there's blood still pumping through your body, and so the organs are alive and can be harvested, and they're very useful. But for most people, they die. They die when the circulation is no longer flowing through their body, and the organs, rapidly, lose their usability. When that happens, and so there's this new procedure. I'm gonna find it and read it here. But there's this new procedure that's being used in Europe and also in America, and basically, it's kind of like a life support that is just there to keep your body, circulating blood such that the organs can be harvested, right? And the problem with our definition of death is this process can get your heart pumping again, right? And if that happens, are you dead or are you back to life, right? I mean, we all know stories of people who have died multiple times and then they come back to life. And so this designation of what is death at the point where we decide we're trying to harvest the organs it's a bioethical quandary that's leading to us not having enough organs.
Yes. Yeah, that's right. The way I understand it, the way that they test to make sure you're dead has a negative effect on many of the organs. And if they use this other procedure, it protects the organs, but it's not clear that the person has died.
Is died. Yeah, right. Exactly. So
this is around our kind of the clinician's perspective, the voice of the clinician. 2 physicians wrote this op-ed in the New York Times about we just need to have a more clear definition of, or maybe a broader definition of when death occurs.
Well, I think that what they're also saying here is that we don't have enough. We don't have enough organs.
Well, that's definitely true.
You know,
Yeah.
so I think they're more saying we don't have enough organs. We're not doing anything to even discuss what we could do to get more organs. People are dying every day. A ton of people are dying. I don't mean the people who are dying because they can't get a match. I mean, just people are dying that are saying they're organ donors. They would like to have their organs harvested to help another person live, more years. But they have no idea about this, right? And so I think there's an interesting question, like, could you allow people to opt in to this additional procedure on top of, there's like the baseline check. Yes, I want to be an organ donor. Okay, great. Would you want to sign up for this process, normothermic regional perfusion? Like, would you like to sign up for this process, which could result in your heart coming back for some short period of time while we harvest your organs or something like that, right? Like, if that's going to mean a 5 or 10% bump in the organs that get harvested over time, that's pretty meaningful.
Yeah, I think that's right. I think that's going to be a lot of education to get people to sign up for. But yes, I think that's what they're saying. Okay,
into Web3, Donald Trump is strengthening American leadership in digital financial technology. Talked about it earlier in the show, but the rollout of this report, this digital assets report called "Strengthening American Leadership in Digital Financial Technology," kind of the blueprint of where they are taking this across their regulatory apparatus. So there's the sections of this document: the digital asset ecosystem, digital asset market structure. So that's a big one, right? Because that's like the tokenization of everything. And as you and I were passing, different links back and forth today, I mean, Coinbase is just riding this news like it's done. It's a done deal, right? Like, we're going to be the exchange for everything. Everything's going to be tokenized, all assets. And look, the truth is they should be.
Yeah.
They should be. Everything should be tokenized. Banking and digital assets. So this is starting to clear the path for banks to actually work with crypto. Stable coins and payments, countering illicit finance, taxation. I mean, all the core things. And like, I look at this report and I just go, it took him 6 months to get stable coins in place and produce this report.
Yeah.
And we're going to talk about the SEC right after this. And it's just like, the Democrats will never get the crypto community back. Never.
Yeah. That's right.
And by the way, that's
sad because it should have been a Democratic ideal.
And it's devastating because the crypto world is only going to get richer.
Yes, that's right. That's right. Richer and more powerful.
And more powerful. Yes. And unfortunately, in America, money buys elections.
Yeah.
And so this was one of those deep strategic errors.
Yes.
Deep strategic errors.
Yeah. There's no question about that. And there's a lot in this document, but it's pretty well put together. I mean, there's little ticky-tack things that I would comment on, but it's pretty good. I mean, well done.
Yeah, because David Sachs wrote it.
Yes.
Of course it's good.
Yes.
You got a great technologist and investor who just convened all the right people, and it's like, here are all the issues.
He called Brian Armstrong.
Yeah,
he called all these people and just asked them, what should it be to unlock this?
He probably called the old CEO of Signature Bank and was like, hey,
sorry, your bank got killed.
Sorry, we killed you. Come on and help me write this. It's just ridiculous.
That's right.
It's just ridiculous, dude. Okay, SEC's Atkins. This is Paul Atkins is the new chairman of the SEC. Most crypto assets are not securities under bold new vision. I mean, could you be any more different than Gary Gensler?
Yeah. I mean,
I don't think you can.
No, they are. And they refer to the former administration and Choke Point 2.0, which unfortunately they did. But yes, most crypto assets are toys. I mean, they're not securities. You're I don't know, buying a tradable thing that maybe it's like a baseball card or whatever. There are some that are securities, and the SEC is going to be clear. That was the main point of this Paul. He gave a speech. This is a summary of it. Just they're all about clarity and defining. This is what you can do. This is what you can't do. This is how you need to pay taxes. That's all the crypto markets wanted, really.
Yeah. Yeah. I just, I don't think I'm ever going to get over this part.
Because it was such an unforced error.
I don't think I'm ever going to get over this part, right? Like this is the part where I go, yeah, this is like a 12 to 20 year regime change. You know, because the average American still doesn't understand.
Yes,
this.
That's right. Most Americans don't know there's usually blockcoin and Bitcoin.
No,
blockchain and Bitcoin.
No, I feel like when I'm talking about this that I sound crazy until I see stuff like this come out, and I'm like, no, I'm not crazy. Like, you know,
no, you're not.
This was really important to get right, and we got it really wrong. I'm saying we because you know I'm not a Republican. Fine, so you know, like we got this really, really wrong, and nobody was there. You know, it's funny. Like that last year, it's like the lights were just out in the Democratic Party.
Yeah.
Like nobody was checking anybody. Nobody checked Biden. You had Dianne Feinstein like literally vote one day and die 2 days later. Mm-hmm. You had Pelosi with all the you know the trading stuff. You know, it was just total hubris everywhere. You know, and I think the party is going to pay for it for, you know, at least a decade. At least a decade.
I mean, I think there's going to be a populist movement in the Democratic Party. The Republicans already went through that. So like
that's going to take
Trump
a minute.
Is the yes.
That's going to take a minute because they don't have a Trump on their side. Like Mamdani and AOC are not that, right?
Yeah.
You know what I mean? Like neither one of them are that.
But crypto, the reason I went there is crypto is really a free market, you know, sovereign individual. It's a populism thing. So the old guard of the Republican Party hates it, and the old guard of the Democratic Party hates it. But the Democratic Party is still run by the old guard.
Correct. That's the problem.
Difference.
That's exactly right. Okay. On to AI. Sam Altman out of PC Mag. Anything you say to ChatGPT can and will be used against you in court. I don't understand the people who don't understand this. They're just having these relationship conversations with this thing. It's not real people. It's a machine. B, for all intents and purposes, it's a database. You have no access to it. You can't like purge it. And yes, like they're going to use the information.
Well, they're going to use it for their own purposes to sell you ads or sell you whatever. But what he's saying here is that it is discoverable. Like if you get into a lawsuit, they can pull your files from ChatGPT. So you're learning how to whatever, cover up something. It's in there, and they must retain all the chats, and then they have to give it over to authority. So
I don't know why anyone thinks this is not the case. First of all, if OpenAI wants to do business with this federal government, this is the buy-in. This is the trade-off, right? This is the trade-off. I'm constantly surprised by the really, really smart people that I know that are just like having relationships with ChatGPT. ChatGPT in particular, right? Like I think
because they have the memory.
Well, oh my God.
The memory is this killer feature that is so evil and yet it works.
Listen,
I don't use it anymore because of that.
That is such a low bar. I mean, I understand.
What is a low bar?
That because it's got memory, I want the benefit of the feature so I can get the day-to-day experience, not understanding what I am selling off of myself.
That's right.
That's what I mean. That's what I mean.
Yes.
That it's just a really crazy trade to make. You know, I can't remember if I talked about this on the show. I know you and I talked about it, and I've talked about it with friends. Maybe more than any other technology ever, the conscientiousness of the leader of the company producing the LLM should be really important to you in the way that you decide to use the LLM.
Yes.
Right?
We have talked about that on the show, and I totally agree.
Okay. So
and this example is the bad example.
Right. I mean, yes, like Sam Altman.
Yeah, I mean, the reason
I don't have any issue with the guy. I'm just saying if you look at the track record of his time at OpenAI, it's just not stellar. I
mean, the reason that Gemini from Google has not introduced memory is not because they can't figure it out. Right? It's not a hard thing to figure out. It's because you don't want to offer it to people because you shouldn't have all of this personal stuff in a file that's not, I mean, that's the Google thing. Don't be evil. Even though it would be beneficial, they don't release it. And I think it is, moderately positive that Sam is saying on a podcast, do not say things that you don't want to come out in a lawsuit or because that's true.
Right.
But no one's going to listen.
Yeah. Yeah. So look, I appreciate him coming out and saying this. I think that's a good mark for him coming out and saying it. But to me, I'm more just shocked by the people who are doing it. And people are doing it every day. So many people. Yeah. If you want to use the thing like a search engine, that's fine. It's the same thing as Google. Like, because, that's fine. But it's the conversations and the divulging of your personal life and these deep things and like that part. No. Wall Street Journal, Tesla and Samsung signed a $16.5 billion deal to make AI chips.
Yeah, this is pretty interesting because it's sort of like the third or fourth place in both fields getting together to improve themselves.
I was like wondering where you were going with that.
but it's actually a good partnership. They kind of need each other.
Is Tesla third place in EVs? I mean, I know by BYD. I got that. Who besides BYD is better than Tesla globally?
Okay, maybe they're second.
Okay.
But I mean, I think that I sort of have Musk as just one large kaibatsu. So I think like XAI is probably third or fourth.
Yeah. Like just kind of across. I mean, there's certain things he's number one in, right? I mean, SpaceX and Starlink are number one in their categories.
Yes, that's right.
Yeah. Okay. Walmart is overhauling its approach to AI agents. This shows you how long they've been in the game. They've been in the game so long that their first attempt was like a whole bunch of disparate AI agents, and now they're scaling those back to just like 3 or 4 core AI agents because they couldn't keep track of all the AI agents they had before.
Yeah, that's right. So it's pretty interesting. They let their employees or whoever just like play around and try things. And so they had hundreds of agents doing all kinds of stuff, and it became overwhelming for everyone because you have too many agents doing stuff. And so they're simplifying to what they're calling super agents. And they have 4, one for customer topics, one for employees, one for engineers, and one for sellers or suppliers. And then those agents have like a chorus of other agents that like report to it or are in their portfolio of capacities. It's almost like I think we're going to have a new type of org chart that is like, here's your agent resources or whatever.
Yeah. It's not the story I was expecting to hear, right?
Yeah, not out of Walmart.
I mean, not only that Walmart is doing AI agents, but they're on like their second iteration of how they're going to do it.
That's right.
I think that's pretty interesting. Meta crushed it. They just keep crushing it, and they keep crushing it, and their stock grew.
I mean, the revenue grew at 22%, and it's a big number.
I know.
I mean, so I don't. It's just incredible growth.
I mean, the only way you stop this business is you gotta carve out Instagram from them, because they're just gonna keep growing.
Yeah,
they're gonna keep growing. It's an incredible business,
and they are. They paid one guy $1 billion to come over. And they're gonna open source everything, which will be maybe good for me as a little VC, but it's gonna be really interesting in the marketplace because
I mean,
right now their open source is not that good, but
so the point here is like why are we talking about Meta hitting in the AI section? Because the market rewarded them with an 11% stock bump. So they went from, $700 to like $750 or something like that. So that was crazy. And then the other thing is that all that money just gives them more money to go buy AI talent.
Yeah, they're spending $100 billion on data centers next year, and
probably $100 billion on talent too.
Yeah, I don't think you can't spend $100 billion. I think they'll spend $10 billion on talent. I mean, maybe,
okay.
I don't know. Maybe they'll spend $100 billion. I think it's going to be.
I've already seen things I thought I'd never see. So I mean, I was joking, but also like I don't know what the line is. Microsoft's cloud unit, bolstered by AI demand, supercharges earnings. So Microsoft is now a $4 trillion company, quickly joining NVIDIA as one of the most valuable companies in the history of modern capitalism.
Right. Yeah, and so at least to me, I want to see what you think about this. There are a few companies that have figured out how to really use AI to their advantage. The cloud providers certainly have.
Yes.
And then I think Meta is using it for ads, to be able to engage people, sell them more ads, target ads better.
Yes.
Those are the places where it's really having a big effect right now.
Okay, well,
but Walmart is kind of an outlier.
I am hearing. So just since you were talking about the cloud, since you said the cloud, I also would include workplace software providers, and there's only really two. It's Google and Microsoft. But I'm just anecdotally hearing more and more and more people just are talking about using AI in the daily course of their day. Now, they're mostly talking about ChatGPT, but I have to imagine that parlays pretty well, I think, particularly for Microsoft. I bet Microsoft Copilot is getting much better usage than Google Gemini is in terms of its integration with the Office suite, 365, and what people are able to use it to advance their day-to-day work and Excel and things like that. It's anecdotal, but I think they're getting strong usage in their Office suite.
Yeah. I mean, I would expect they would eventually. I don't know if they have yet or not.
My guess is it's crossed the threshold now where like it's meaningful, like it's worth tracking. And here's another thing.
And then coding. I mean, definitely coding has been successful.
Okay, here's another one. Transcription of video calls.
Yeah,
we know that that's happening across Zoom, Meet, and Teams.
Yeah,
big time.
Yeah, that's right.
Right. By the way, that just gets me back to like these third-party businesses, right? It's like, there's like Fathom and some of these other, AI note-taking things.
Yeah, those are not long for the world.
Yeah, but how much money do they take in? I'm just kind of going back to your Scribe, being a feature, not a platform thing. Yeah. Right? It's like, isn't Epic just going to like turn on a Scribe thing?
Yeah, Epic or OpenAI or Anthropic or Gemini.
Yeah, you get my point.
I mean, I just switched from Calendly to the Google Calendar.
Oh yeah, it's great.
And
it's fine.
There's no business for Calendly anymore. Like,
no.
I'm sure Microsoft Calendar will have something similar, and then you're done.
Right. Yeah, but these kind of features.
Yeah. Standalone kind of feature-ish
for
products.
Huge markets that a Microsoft is going to go after, right? You know what I mean?
Yeah.
It's like you're just better off. I hate to say this because this is our playbook, but like you just got to focus on a smaller market that they don't care about. That's still like $1 billion or more.
Yeah.
Still a big market, but it's like they can't get to it. They're too busy fighting each other over like $100 billion markets, market opportunities, right? Okay. Dario Amodei is raising another round for Anthropic, potential $5 billion round at a valuation that could be $170 billion.
Yeah. It's incredible.
I love Claude.
Yeah.
I love Claude.
I do too. I mean, I use Claude and Gemini probably, but maybe more Claude.
I love Claude. It's great. It's awesome.
And their revenue has tripled this year. But their expenses have also gone up dramatically.
Oh yeah. No, it's a raise.
That's why I think they're subsidizing it. Like they are not getting paid for the inference costs.
Right. Lovable. I saw this on X, so I'm glad you brought this up. Lovable is a unicorn, and they are generating $100 million. This is a vibe coding company. So We now have Windsurf, Lovable, Cursor, Replit, all these companies.
Yeah.
Just
They all do the same thing.
mind-blowing revenue
Yeah.
numbers. All of
Yeah.
them.
And I think, I'm going to get this right, but I think Cursor beat the record for
They were
fastest
first.
to
They were
100
first.
million. And then I think Windsurf did not beat their record, but Lovable did. So now they are the fastest to $100 million in annual recurring revenue. It took them 8 months to get there. I mean, that just the signing up customer, even if you had unlimited customers standing there, getting that many to sign up in 8 months is hard.
It's incredible. It's incredible. Yeah. Okay, we're almost there. Amazon to pay the New York Times at least $20 million a year in AI deal.
Yeah, this is an interesting story on a couple fronts. One, that Amazon did it. Now, maybe they've signed a deal with someone else too. I can't totally remember, but I'm surprised Amazon was the top bidder. And then we were talking earlier, I think New York Times is one of the few media companies that can really
Best run media
do
business.
this. Yeah.
Best run media business. Yeah, not even a question. They've navigated, these last 10 years exceptionally well. Digital strategy, Binding Athletic, Wordle, just a brilliant, brilliantly run media business. And they got the memo on this early. All the newspapers lost to Google in the first round. So they all knew kind of how to position themselves. I'm not sure what the long-term trade here is on this $20 to $25 million in terms of Amazon. But, I think the New York Times just thinks about these things as just distribution of their brand ultimately, right?
Yeah.
And they're, it's all licensing, right? It's all licensing for them. So anyway, I just think this is a great deal. And it makes sense. Amazon, they need to be a good player. They need to be playing by the book. All right. Texas highways have a new nighttime creature, autonomous trucks. Wow. Aurora Innovation says its driverless system can detect objects further than the length of 3 football fields in the dark. So if you didn't know, if you're driving around 2:00 in the morning in the highway in Dallas, Texas, or in Houston, you may be on the road with an autonomous truck. You probably are on the road with an autonomous truck.
Yeah. And the article claims, and it seems like it's probably right, that the LiDAR they use is far better than human eyesight in driving in the dark, which I guess kind of makes sense. I'm still struggling with the fact that humans are not going to be the safest way to drive trucks around the interstate, but apparently we're not.
I feel like we've litigated this a million times, and I don't want to do it at the end of the show.
Yeah.
But I'm just tired of the bullshit narratives that like we're not going to just collapse jobs. We are.
We are.
We just got this to me is maybe the one thing most people are not tracking that could end up really being a massive downfall for Trump. If this, and I only say that in terms of like the acceleration, if it keeps moving at this speed, it's moving so fast, Vic. I mean, thank God for this show. I just don't know how I would
even know what's going on.
Even wrap my head around how fast it's moving, right? I mean, our final story, right, that we're about to talk about here in a second. But man, this is moving so fast. There's no way this is not going to collapse our labor market. There's just no way.
I think that's right. I don't think it's going to happen while Trump's in office. I think it's the next president. But yes, 5 years, 3 to 5 years from now.
So you think it's that far out?
Yeah, I mean, I think it's going to take a while. I mean, right now they're only driving from Houston to Dallas. Like Waymo, I think.
They're driving
from Houston to Dallas. Yeah.
They're driving.
There's no technical reason they can't drive across the whole country. But I think it'll take a few years. Like I look at Waymo. I think.
Okay, let me totally go to a different topic.
Okay.
2 weeks ago, would you have thought even like in the realm of possibility that we were going to dig a tunnel underneath Nashville from the airport to downtown?
I didn't know that was
going to run
even
Tesla,
in discussion.
Teslas.
We didn't talk about it, but yeah. So people that didn't see the news, the Boring Company is now going to dig a tunnel between downtown Nashville and the airport and run only Teslas, I think, through it.
Yeah, it's a business model.
Yeah.
Because they don't charge taxpayers. It's a privately executed, basically the state will grant them the access to the land, maybe ownership of the land or whatever, however that works. I'm not smart enough to know the technical aspects of the deal, but the point is it's not a taxpayer funded thing, which is why they really don't have to take it to referendum, right? They just leverage state-owned land.
Yeah.
But then how does, the Boring Company make money? Well, it's part of the Musk, ecosystem.
Yeah. I would have conceived of it 2 years ago. I mean, 2 weeks ago. Never mind, 2 years ago.
Yeah. 2 weeks ago.
So the answer to your question is I would never have considered
That's my point.
But how long will it take for them to dig it and be live?
It'll be live before the end of next year.
Okay.
It'll be live before the end of next year.
I want to ride it. Going to the airport is a pain in the ass. So I might buy a Tesla just to go.
No, but you get my point, right?
Yeah, it's happening quickly.
It's just the speed of this is all just insane. And we'll punctuate that with interestingengineering.com. China's Unitree launches a full-size humanoid at just $5,900. The thing does a cartwheel.
It is 5 feet 5 inches tall. It can walk. It can dance. It can do cartwheels. It can jog around. Born for sport is their tagline, and it costs less than $6,000. You can order it personally, and they'll ship it to you. And then it also is open source, so you can hack into it. You can use open source coding to make it do a new dance or make it work in your factory. Now, the downside is that the battery only lasts an hour. So you have to figure out a battery thing. But Musk has the Optimus, and those are not ready yet. But Musk is claiming they'll be $20K. So it's not that much more, but he's claiming that will happen whenever they're ready in a few years. This is now. You can buy it today.
Now.
Yeah. And so obviously an hour-long battery is not sufficient, but that's a fairly minor. Let me buy 5 batteries and I'll just swap out the batteries as I need to go. I don't know exactly what I would use it for, but it's at a price point where you're almost like, what the hell? Let's buy one.
I was about to say, you don't know what you would buy it for, but you could sell how much of a Bitcoin and get one? I mean, not even a tenth.
Not even a tenth.
Not
20th,
even a tenth.
20th or something.
Not even a tenth.
Yes.
Every crypto bro is going to have one.
Yes. Yes. We're going to see him walking around Nashville.
Yes. That's before the end of the year.
Yes. Yes.
I remember the first time I saw a Cybertruck and I was like, WTF, what the hell is that thing? And now
they're everywhere.
Now they're everywhere.
Yeah.
Dude, we're going to be walking around with robots before the end of the year.
Yeah, that's right. And people will figure out something to do with them. At this price point, you don't even have to be that effective.
It's cheaper than some breeded dogs. I'm serious.
Yes. That's
ridiculous. Right. All right.
And again, China is, they're playing for keeps.
Dude, they're so far ahead. They're so far ahead of us. They're so far ahead. I think at this point,
I don't know if they're ahead, but they have a different strategy, right?
No. They're ahead. They're ahead. Okay. JD Vance made that point on that speech, and he was exactly right. We thought we were outsourcing the unimportant parts when we gave them manufacturing.
Right.
And it was what he's a smart guy. When he said manufacturing is design, dude, that was a profound statement. That was a profound statement. Is absolutely right. Because think about it this way, right? Elon Musk is so impressive because he plays in the world of atoms, not bits.
Yes,
that's why
that's
he's
right.
so impressive, right?
That's what distinguishes him from all the other entrepreneurs.
That's the reason, right? And he came from the world of bits. He came from PayPal, right?
Right.
But the reason he stands out is because out of all the brilliant entrepreneurs and engineers in Silicon Valley, he is one of the very few who decided to do that. We mostly went in the direction of bits.
Yes.
Because we outsourced all the atom stuff to China.
That's right.
And now it's like they're ahead. They're ahead on cars. They're ahead on robots. They're ahead on working with less.
They're ahead on power.
They're ahead on power. They're ahead on rare earth.
Yeah.
They are ahead. They are ahead. And
their competitive markets are aggressive. And that
with no regulatory barriers.
No. It just, go ahead and steal whatever you want to steal.
Yeah, and by the way,
so we're complaining about Novo losing something. I mean, people, there's no IP over there.
Dude,
there's everything.
And this is exactly the narrative that Trump is going to leverage reasonably. I won't go so far as to say rightly, but reasonably so, as he does the whole Relaunch America thing, and he cuts half the regulations out of the, out of the books.
Yeah,
he's going to be like, we cannot compete with China. And you know what? He's going to be right.
Mm-hmm. Yeah.
He's going to be right. He's going to be right.
Yeah. So
it's a hell of a way to end the show, but
yeah.
But on that note, I will not be here next week.
Yes. So I'm going to find someone else to guest host. I don't know who right now, but I will figure it out.
Good luck.
Maybe we'll get a robotics expert.
Oh my God. You had to say that, like robotics expert. It's like one day we're gonna buy a robot just to fill in for you and I.
Yeah,
on this stupid
That's
show.
Right. Yeah, I'll get a Marcus robot and just put it.
It's disgusting. All right, man.
All right.